All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So today we will dig into the data COVID dashboard data from Alberta. There are some areas of the data that could actually use further deeper dive and some updates as well. So let's start looking into it. So for references, this is drbeen.com. This is the Alberta's data. We're going to look at these definitions because there has been a lot of commentary that their definitions may not be the best in the world. We'll look into that. This is their population related data. This is the actual data that we are going to look at, especially these areas that we have highlighted, where they're saying, for example, that 54.8% of cases were unvaccinated, or 68.1% hospitalized cases were unvaccinated, or 67.6% of COVID 19 deaths were unvaccinated. And I want to make sure that we look into that and understand if that is really still the case. Short answer is that is not the case. It is actually very different situation at this time. So I would clarify that. I spent some time today doing the math. These are the hospitalization tables. We'll use that data as well. This is the hospitalization to ICU to death, and we'll look into that as well. This is a quick review of some of the work that I had been doing today to make this data a little more clear. So with this, let's start. So first of all, let's look at how Alberta define various things. So their definitions. Alberta's population is about 4.46 million. They say recovered is defined as it is based on the assumption that a case is recovered 14 days after a particular date of their infection. For confirmed cases, specimen collected date is used, and for probable cases, date reported to Alberta Health is used. So from the date of the case, 14 days after, they assume that to be recovered. Deaths. So this is that with or from. So a death resulting from a clinically compatible illness. So an illness that looks like COVID illness in a probable or confirmed COVID-19 case. So either it is a confirmed case and is dying of something that looks like COVID, or it is a probable case and still dies of something that looks like COVID. They consider that to be COVID death. Unless there is a clear alternative cause of death identified, for example, trauma, poisoning, drug overuse. Then the pre-existing, the definition of the pre-existing that they use in this data: diabetes, hypertension, COPD, cancer, dementia, stroke, liver cirrhosis, cardiovascular diseases, including IHD and congestive heart failure, chronic kidney disease, and immunodeficiency diseases. These are the pre-existing diseases. Also, I want to clarify, we will take a few rounds on this data. So today I'm going to do specially some updates. I don't want to say correction, some updates to their data stats that they have as a summary. And number two, the children and the risk at 11 years and under. That is the topic for today. Then tomorrow we'll continue, plus we'll start answering the questions on Twitter and YouTube as well. So vaccine coverage. This is also something that has been asked of me many times, that make sure that look at their vaccine coverage or the definition of the vaccine. So individual who received at least one dose was calculated as number of individuals who received at least one dose divided by population estimate. Similar for the two doses. Now, the question that, again, here, this reference 4.464170 is their population. Now, some definitions here that are important. Unvaccinated in their books is defined as a person who was known to be not vaccinated or diagnosed with the case or COVID within 2 weeks of the first dose. So if I got my first dose and 2 weeks have not passed and I got COVID, they would count me as an unvaccinated COVID case. They do the same thing for the boosters as well. For example, if somebody actually had the third dose, the booster, but there is no 14 days gap yet, and so from the third dose and before the 14 days after, if somebody becomes ill with COVID, they would consider that to be two doses. So that is, and the reason they say is that the definition is of protection. So they have that definition here. Vaccine status category is based on protection. Doses administered within 14 days prior to a person's COVID 19 diagnosis are not considered protective. As a result, vaccination categories only include those identified as cases over 14 days past their first or second immunization date. So these are the definitions. Now, what is the big thing I want to discuss today? This summary here. I think that it is important to update this summary, although they can have you look at this table and say, we have some data that makes sense over here for the latest situation. But what you would see is that this data in the table can still create a confusion by saying that, hey, the data looks like this because the cohort size, the group size of vaccinated or unvaccinated are different. So I'm going to address that in a second. I just am putting the context in front of us. And I want to clarify this part first. If Alberta administration is somehow listening to this talk, my request to them will be that just as they have these last three lines for the whole year, starting from January 21 to now, if they can add three more lines, which either go from December till now or January till now, they actually have that data. They have tables in this page, on this page, that address 120 days from today. They can create that summary. And I created that summary as well. And you would actually be surprised with the data that you would see. But again, that is the data. So let's start. I'm now going to go to my presentation and discuss it. So I have no disclosure. This is my latest painting I did over this weekend. This is sunset on a poppy field. And I did that on digital paints. So this is a 4K digital oils done in Rebel 5. Rebel 5 is actually a Canadian company, I believe. It is called Escape Motion. Beautiful program. All right. So we are in the Omicron era. We are in actually BA2 era. And let's start. Medical disclaimer, not a medical advice. Alberta, population 4 million and 464,170 number of people, 4.46 million. Limitation of this data. And this is, they actually have the data. I downloaded their data today. Within their data, they do have status as well as confirmed, recovered, and so on. Although the data that they present in that data, in the vaccination outcomes data, they do not recognize previously infected and recovered, which I think is a huge gap. Even CDC has started recognizing it. UK had started recognizing that much earlier. This is the data that should be recognized. So previously infected data is not separated. So we don't have much idea of that. Antibody waning data is not present here either. Long COVID stats are also not present. So I think it is important to put this in front of everyone to say the risk with COVID is this, the risk with vaccine is this, the COVID injury and the long COVID can be this way, the vaccine and possible side effects could be this way. That data should be out in front of everyone. We are at the tail end of the pandemic. There is no need to still kind of not present some data and selectively present other. The objective for the discussion today is we're going to look at their summary. We are going to look at last 120 days data. We're going to look at their current snapshot, today's situation, and especially in terms of vaccinated, unvaccinated, and how are they represented today? And then the age data. Today's main scenario after this summary review is children age 11 and under, how are they performing in this whole situation? Then we'll continue tomorrow with others. So here is what I did. So this is my first take on this one. Read this line with me for a second. 54.8% of cases, and then they give a number, 221,696 out of 404,792 since January 1st, 2021, not January of 2022, 2021. So more than a year ago, were unvaccinated. Right? So you look at that and you say, oh man, that is really bad. Unvaccinated 55, 54, or 68.1 hospitalizations unvaccinated, or 67.6% of the people who die are unvaccinated. But look at this chart, and this is also the chart from their site. So they have these charts here. I have the links in the description. If you look at this chart, in this graph or chart, what they're showing is various vaccination statuses: 1 dose, 2 dose, 3 dose. The purplish line up is the 1 dose, then the blue is 2 doses, and then the orange is the 3 doses. If you see here from the beginning of the last year till today, in the middle, the vaccination status almost flipped from majority unvaccinated towards majority vaccinated. Now, when we were in majority unvaccinated state, at that time, everybody who was getting in the hospital or having a case or dying was unvaccinated. And that is a good stat to understand that when people were not vaccinated, the vaccines were not yet fully distributed, they were not available, they were not given yet. This is what was happening. Today, there are two things that are really important to consider. Number one, a majority of the population is vaccinated. So at this time, the right data to show in summaries is to say, we have this many people, 80% people vaccinated. The risk or the incidence of the disease in vaccinated is following. Incidence of the disease in unvaccinated is following. Probably adding also the previously infected and recovered. Number one. Number two, in the recent days, there is one more cutoff of the data, and that is Omicron. So, in my opinion, this is why I had proposed at one time to say we should acknowledge that we have SARS-CoV-3 and we should acknowledge that we have COVID-21, or call it 22. Because the data are different, the behaviors are different, outcomes are different. And now, for example, when they say Alberta, when they say 120 days from today, that includes a lot of Delta cases as well. And those Delta cases are skewing the newer numbers. So that means there are two things that are skewing or causing imbalance in the numbers or hiding the actual picture from us. That is looking at the whole year's data, which includes a lot of unvaccinated status, and then looking at Delta's data mixed with the Omicron. That is a primary problem in this. And I don't know if it is deliberate. I just think that someone there can go in and say, you know what, I'm just going to add 3 more lines here and put the stats since January. Okay, so what I did was I took their charts, and if you see here, these numbers here, for example, 77.2%, 72.1%, and 11.7% are the percentage of population. You could actually hover your mouse over various dates, and it would produce the numbers for those dates. And I took those numbers for current today, and there today is Feb 6. Today's data I took October 15th data, almost about 120 days. October 11, I found out later on by Alexa that it was October 11. So I have 4 days skew. I took those data and recalculated according to the vaccination cohort size, unvaccinated size, and then their representation in cases, hospitalizations, and death. You would actually be, uh, it is interesting data. So here, this is 25 January. If you see, almost 80% one dose, almost 74% two doses, and 32% three doses. This is a summary which I think is good but needs extension. It is kind of outdated. Now, why does it need extension? I just explained it that the shift occurred twice, one for the vaccination status from minority to majority, and second from the virus's behavior from Delta to Omicron. So what I did was I updated this for us. So I took October 15 as a cutoff date, and I used their 120-day tables to do that math, and here is the math. And I'll show you that. Let me walk you through this math. Math is the following. Unvaccinated, this is October 15th. Instead of taking the whole year as the vaccination status, I'm taking whatever was the status on October 15 as the status to represent 120 days. You know that even that is an incorrect presentation because over the time of these 120 days, vaccination status further changed. For example, how much did it change? The one dose changed from 72.8% on October 15 to almost 80 point some percent now. So another 8% change occurred. So you can think of this that there is still a fudge factor here. Not too big though. So unvaccinated, 27.2% on October 15. That makes it 1.196 million people, almost 1.2 million people. In those 1.2 million people, in the last 120 days, there were 44,811 cases. This is the number I had to summate. They have those numbers here in these tables, but they do not have. It is interesting. Under the table, they don't have totals. They just have tables. So I had to take this table, bring it in here, create the totals, create the percentages, calculate the single dose definition separately, and then create their percentages of overall sizes. So it was just a lot of busy work. Okay, so 44,811 cases in unvaccinated. Percent of the population, the unvaccinated cohort, these are the cases within that cohort, that is 3.74%. Cases, we're talking cases. And cases definition at this time is up in the air. Why it is up in the air? Because there are, for example, take my case. When I got COVID and I called my doctor and I said, I got COVID, what should I do? Should I come in for testing? They said, no, stay home. Don't need the testing. Assume you have COVID and just work with that. And then I came in and I said, can I have some drug and blah? And they said, no, you're not eligible. Although I received an email today, it is so interesting from them to say, let me actually read it to you. The email says, Santa Clara County has asked us to advise you of your new patient rights to receive COVID-19 testing within 24 hours of request and results within 72 hours. I had been asking, can I please come in to get tested? They said no. Instead, they were telling me, when can I go back in the society? Anyways, I don't want to digress here. 3.74% of the population, unvaccinated population, has the cases. I'm sure that there are tons of cases that are unvaccinated and vaccinated, and they're not even reported because they're mild or even lesser than mild. My case If Rima would not have asked me to test it, I would not have tested it. I thought it was just common cold. I was under the weather. So, considering that we realize that the case numbers are really not a true reflection, still, one dose only. So, what I did was total one dose, 72.8%, total two doses, 66.1%. So, if you subtract them, that gives you one dose only. That was 6.7%. This is October 15, I'll keep reminding you. So the size of the cohort that had received one dose only was 294,800. Now, please remember, in the unvaccinated, that group size is a little larger because over the 3 months, that size reduced further. Number two, it is a little smaller because it should be a little smaller as well, because those one dose patients or people who developed COVID before 14 days after the dose got added to unvaccinated count. So, with those definitions in the mind, 294,800 people size. Out of them, in last 120 days, 8,891 cases. That is 3.02% of the cohort. So check this out. In unvaccinated, 3.74% of the cohort. In one dose vaccinated, this is one dose accepted 14 days after the one dose, 3.02%. Then two dose. Two dose was 61.6%. It's a larger cohort. You would expect it to have more cases as well. Understood. We've done a percentage over here. So again, this is not a thorough study because there is no multivariate analysis and there is no univariate analysis and there is no age stratification here. So it's not a study, it's not an efficacy study. This is just a comparison because I believe their summary is showing some data that is making people nervous, while the actual data, even when we want to say that, hey, you should go get your vaccine, at least show the correct data. So here, this is two doses, only 2.7 million people, larger cohort, the largest cohort. They had 117,506 cases. That is 4.34% of the cohort. Again, I know that this can become dismissed by saying, well, their larger cohort, number one, number two, the case definition is up in the air. Got it. But we are treating them all in the same way at this time. So 4.34% of the population cases, population meaning the corresponding cohort, is the two dose. Three dose on October 15 was 4.5%. Out of those three dose, so that is 198,000 people. Out of them, there were 26,584 cases. Again, look, people who are three dose, they do have a risk or comorbidity or extra exposure. There was something that they said, you know what, I should go get my third dose. Not necessarily 100% of them, but a lot of them. So we would expect maybe age. And Alberta has that data. We don't have to speculate too much. We'll actually look into that data. So it is, their exposure can be more. So if you see here, look at the numbers. 4.5% were third dose. Total count 198,000 population. The cases in that population 26,584. 13.43% of the population, the corresponding population, not of all the cases, but within a cohort, this is the case incidence percentage. So of course, the limitation here, I had done this population rounding to 4.4 million, vaccination status on 15 October. I did not do the calculation every day and then do a summation. I didn't do those um, sophisticated studies. I just couldn't do it in one day. Case count for 11th October, actual case count on the Alberta data is from 11th October. So 4 days fudge factor. Vaccination status does not have the days after the vaccination. On Feb 6th, the total vaccinated rate is actually 80%. So from 72 to 80%, there is a further difference. However, those calculations are beyond the scope of this discussion. I wanted to show you the trends. If you take this data and then you go back to this data, then I would say this is good to say, hey, you know what? In our province or state, in the last whole 1 year, 54.8% cases were in unvaccinated, because majority of us were unvaccinated at that time. They could have added one more line here to say, in last 120 days, the situation has improved and now people are less at risk. There are two types of messages here. Compared to Delta, Omicron may be better. This data doesn't show us, and I would love to see that. And number one and number two, as the vaccinated versus unvaccinated percentages change, the case counts are changing, and those should be reflected too. Okay, I'm repeating that part. So then I want to show you this table right below this table, this summary. This table is interesting because it shows new cases. This is a point in time data. So today, if you take a snapshot, then what is the data? I love this data that they put out. So it's not that I have any problem. I love it. Um, New cases, active cases, hospitalized cases. And there they actually show it. For example, if you look at new cases, 3 doses, cases are 375. So now who are the 3 doses? What is the population size out of which 375 cases? That population size, if we take the population on October 15, then that was 198,000. At this time, though, the third dose percentage has reached 32%. But again, this is 120 days and the percentage kept changing. So new cases 375. Now this percentage that they're saying over here, 33.24, that is the percentage of the new cases, not of the corresponding cohort. I think that should be extended as well. There should be one more column here to say out of its corresponding cohort, the percentage or incidence rate, some way of showing that too. That would actually tell us the risk or the efficacy with the comorbidities, with the age factors. I mean, that is all understandable and that data is present. And we are not that simple at our mind that we cannot understand those extra data points. If they're here, they would help us. At this time, this is the percentage of the cases. So, for example, 2 dose, 36.35% of the active cases. 1 dose, 3.99, unvaccinated, 26.42. Now, unvaccinated, what is their cohort size? About 1.19. You could say that anywhere from 800,000 to 1.2 million. It's going to be in that area. And at this time, today, for example, today is Feb 6, 26.42% are unvaccinated. Now, are there infected and recovered? Are there youngsters? Are there people who are healthier, less comorbidity? They actually have that data down here. If you see, for example, with comorbidities, with condition, no condition. So it's not a lot of speculation. We can actually go and look at that data, and we will. I just wanted to give you the thought that if right in the beginning here, such, I would say, scary. I mean, they can say this is data, this is truth, that is correct. When I looked at it, I became a little scared for a second to say, oh, man, that is a very high percentage for unvaccinated. And then when I looked at data, the current data is different. So then look at these were the new cases. Look at active cases. Three doses, active cases, 28% of active cases are 3 doses. 47% of the active cases are 2 doses. And once again, you could say that's a larger cohort. 1 dose, 4.8, and unvaccinated, 20%. And once again, you could say that unvaccinated are 800,000 and remaining 3.8 thousand or 3.6, 800,000, 3.8 million are the remaining folks. So, of course, their size is larger. But why to make us speculate those things? Why not put the data out here? Better yet, add that summary over here. We are, we are, I mean, not me, but the people of Alberta are your citizens. If you put that data out, it will give them comfort. It will give them understanding. It would reduce the nervousness or confusion or mystery. Then down here, currently hospitalized, 3 doses, 25%. Currently hospitalized, and I want to make sure, if you see here, it says percent, this is count. So 2 doses, 40%. 1 dose, 4%, and then unvaccinated, 29.96. So once again, you can see it this way as well. You can say unvaccinated are about 800,000, about 20%, but their representation is about 30%. 3 doses is actually a smaller percentage, about 32% at this time. But their percentage from their own cohort is large as well. So I hope this makes sense, that if you look at it, there is it is actually not the same picture as you get when you read this. This is good historical data to say this is what happened. And I wish there was more current data in the summary to say this is what is happening. That would give you the right amount of concern, right amount of decision making power to understand what to do next. Okay, continuing. I brought this image in here because every day these tables change as the new data comes in, and every day they update the data, these tables change. So I just, for historical purposes, I put that image here. Now, snapshot. Snapshot is today. So today, that is Feb 6, 80.6% are 1 dose, 74.9% are 2 dose, 33.9% are 3 dose. So if I go back here, this is the reference image. Cases, once again, cases is, you can say cases are up in the air, they are undercounted or overcounted or incorrectly counted. That all is a given. But because we are looking at the cases and data, we have to look at it. Alberta's page shows them. So here, I did one more math here. If I go here, this is the active cases data. I brought their table in, did the summations, then created the percentages. For example, at this time, if you see here, can I make it bigger? 1 second. Just to show you my homework. If you see here, total population 446, unvaccinated 19.4% today. That makes it a 866,049 from their estimated population. One dose, 254,000. Two doses, 1.83 million. Three doses, 1.513 million, because that is 33.9% now. Cases is what I took from their data, and percentages are here. So I'm going to show you that over here. Look at this. This is very interesting. Unvaccinated individuals, 866. Cases in them today. This is snapshot. Tomorrow they're more, or yesterday they were less. Don't know. Or will they become less tomorrow? This is today's snapshot. 5,998 active cases. That is 0.69% of this cohort, not of the total cases. One dose, 254,000 people, 1,469 cases, 0.58%. Two doses, larger cohort, but still 1.83 million people, 14,183 cases. I should have put commas here. 0.77%, 0.8% if you round it up. In unvaccinated, these are percentages, again, not stratified, but percentages of cases. In unvaccinated, the cases are 0.7%. In two doses, the cases are 0.77%. In three doses, the cases are 0.56% of their cohort, not compared to the other one. It's not an efficacy study. So in this data, the data that I'm showing, the age breakdown is not present. They have the age breakdown. I just didn't have enough time. I thought we'll do a series where we'll go over the deficiencies in the summary. Then today we'll go over children's age bracket. Then we'll continue with other ages as well. So I didn't do a lot of calculation in there. So there is an imbalance in age-based cases, and I'll show you those. For example, in unvaccinated, children are getting more infected. In vaccinated, older age folks are becoming more infected. And there is a reason as well, and that is that many of the older age folks have become vaccinated. Many of the people with comorbidities have become vaccinated. So there is those kind of things to consider. Previously infected and recovered data is not present. Antibody waning effect is not present. I said that already as well. So now let's go to the last part of the discussion today, and that is the age group analysis. So let me show you that their own page has a lot of very interesting, important data. Look at this. I'm just going to give you a quick view of the data present. You can then check it out yourself by yourself as well. Look, cases, table number 4, cases, and in here, 3 doses with comorbidities, no comorbidities. 2 doses similarly broken down, unvaccinated similarly broken down. So that, I think, is a great thing they've done to separate the cases with comorbidities and not, so you could actually see what is the effect of a comorbidity. For example, let's look at 80 plus year. 80 plus year, 3 doses with comorbidity. So age 80 plus, doses 3 with comorbidity. 52.3% of the cases of this age are 3 dose plus comorbidities. No comorbidities, lucky them, 80 plus, no comorbidity, 13%. Just for comparison, check out the right side, unvaccinated 80 plus. Of course, that would be a smaller cohort, quite small cohort. With comorbidities, unvaccinated, 8.7%. This is the cases. And without comorbidities, 3.2%. And why? Number one, this size remaining unvaccinated 80 plus are less. Number two, the ones who were really at risk, they got their vaccines. So it makes sense for them to be here. But still, I think saying that please go get vaccinated is a separate discussion, separate messaging, and then showing the data has to be a separate way of doing it. They have done a great job of showing this data, but the top summary is I'm still kind of not. It needs to be extended. Okay, so they have cases data. Similarly, if you see, this is the vaccinated status and pre-existing condition. Pre-existing condition. Then they have hospitalization data in a similar way. Then they have, so these bars, blue bars, I was working with someone over the weekend to make sense of these bars. What they mean is the following. Let's take 80 plus. What they're saying is, so this is the COVID-19 hospitalization count and rate per 100,000 of the population. So they're saying for 80 plus, the 3 doses and hospitalized are 464. 2 doses and hospitalized are 528. No dose or unvaccinated and hospitalized are 412. Now their cohort sizes are different. I would suspect that unvaccinated and hospitalized are a tinier cohort. And so then they're saying that the rate, unvaccinated and hospitalized rate per 100,000, if you take a rate, that is 4,708 per 100,000 if you extrapolate it. I don't think that cohort size is that big. If you take 2 doses, 80 plus, and if you take 100,000 individuals, the rate will be 2,144. If you take 3 doses and 80 plus, 447 per 100,000. So they've done that extrapolation, which is also excellent data. You can look at this data for your age bracket and then your status, vaccinated, unvaccinated, um, comorbidities or not, and you can see what is the risk percentage. The only missing piece, previously infected or not, that is missing. So that is great data over here. Then they have, look at this, hospitalized COVID-19 cases in past 120 days. I actually used these tables to make sense of the last 120. Now, last 120 days are still a combination of Delta and Omicron. I would have really loved, let's say, January onward, just Omicron and the data there. So I downloaded their data, but that data was so diverse in various Excel sheets that I needed the softwares to put that together and stratify it and then compare them. So I just left it. So here, this is the hospitalization cases. So the point is that data is here. I want to show you something that is interesting. Age group 11 years and under. Cases. So I brought the picture of the table, so it might look small, but the point is not to really read it. What is interesting is this. On this side, 11 years and under, no comorbidities, is almost 8 and 11, 19,000 cases in this age group, 11 years and under with no comorbidity. And then if you see here, another 1596 plus 366. So another about 2,000 cases. So 21,000 cases under this age group, within this age group. And if you see the remaining size of the unvaccinated and the infection rates in them are actually lower. Look at this. And that is understandable. 80 plus have mostly gotten, let's say, vaccinated. Younger children are not vaccinated, so there are cases in them as well. This would be interesting for us to see if they have 21,000 cases, are they represented in the hospital in the same way as the higher age groups You know the answer. The answer will be no. And sadly, are their deaths in the same way? Now, as rich as their data is, one thing that they missed was to separate out deaths by comorbidities. For example, in this age group, 11 years and under, there are a total of 3 deaths. So it is not a zero death age range. There are 3 deaths. The question only is, were they in comorbid or not? Or was there a mixture? For example, there is some data which shows that in children, it is the majority is with the comorbidity, maybe two-third comorbidity based patients, and one-third who die are healthy. So it's not a zero situation, but they did not give that breakdown of saying comorbid children had this risk. And this is also why you would see that here children with comorbidity had lesser cases. Why? Because it is possible that parents who know that their children had comorbidity, they were very careful. They were not, they were doing their best not to expose them. Maybe some of them got vaccinated, I do not know about that. And then healthier children. Now, if I go forward, just to quickly show you, before, carry one more number in your mind, 12 to 29. Although I think that's a very large bracket, it should have been up to 22, 23, and then onwards. But, anyways, they said 12 to 29. In that group, 1,268 cases with comorbidity and 6,680 healthy. So about 8,000. So keep this in mind, 21,000 under the age of 11, 8,000 age of 12 to 29. Now look at this. I'm going to come back to that in a second. I want to show you this part first. This is unfortunate thing. I think the saddest thing of death of a child. So deaths here, 11 year and under, out of those 21,000, without knowing comorbidity status, 3 deaths. This is the last 120 days. And then the next one that had 8,000 patients, 5 deaths. So 21,003 deaths and 8,005 deaths. And then as you see, this number continues to rise. So there is definitely a contribution of age. There is definitely a contribution of comorbidity. If I go back to the comorbidity tables, you would see predominant factors towards comorbidity. So I wanted to make sure that we have looked at this data, 11 year and under. What is the takeaway? Number one, infections are occurring. Now, there may actually be more cases than 21,000 in that cohort, but it is possible many of them are just not even identified. What made someone to go get the test done must be concern or aspiration or incidental. And then it is also not a zero death bracket. That is the takeaway. So I want to show you these tables here as well. So this is the hospitalized cases. This is ICU. So if I see the ICU once again, look at the 11 years and under. And please, I am repeating it that I am not looking at the other ages. I'll do that discussion separately. I want to focus on this one. 11 years and under, ICU. If there are 3 doses, 0 cases, 2 doses, 0 cases, no doses or unvaccinated, 37 5 years and under, 12 5 years 11 years and under, or 5 to 11 years. And as you see, if you continue to go up, you would see that the data is changing. These numbers, these graphs that are across, they are representation of the rate within those cohorts. But then from top to bottom is just a simple understanding of how various brackets are at risk or are protected. Then here, table 9, hospitalized cases ICU in the past 120 days. I wish this summary of past 120 days was represented up top. So again, 5 years or 11 year and under, 3 doses, 0. This is the ICU. 2 doses, 0. Unvaccinated, 12 and 37. This is the hospitalization cases in ICU in the past 120 days by vaccine status and pre-existing conditions, so comorbidities. So if you see here, this is all ages. 1081 total, including dose 1, 3 doses, last 120 days, 3 doses with comorbidities, gotten 3 doses, 4.7%. No comorbidities, 3 doses, 1%. 2 doses, comorbidities, 17.5%. There is the waning effect. 2 doses, no comorbidities, 3.7%. So that is the waning plus the comorbidity itself. Unvaccinated with comorbidities, 47.4%. This is last 120 days. And then you can see that various age brackets have their differences. And then unvaccinated and no comorbidities, 22.3%. So this is also very interesting data to look at. And then this continues. I hope that it makes sense. I'm not deliberately leaving some of those. I just looked at the time and it is 6:53. So I'm expecting you can look at it. Let's see one more. This is last 120 days, death data, and the vaccine status and the comorbidities. Total 795 deaths, 3 doses, 15 point with comorbidities, 15.8%. No comorbidities, 1.1%. So comorbidities are contributory. 2 doses, comorbidities, 25.7%. 2 doses, no comorbidities, 1.9%. Unvaccinated, comorbidities, 43.5%, the largest size. And then unvaccinated, no comorbidities, 7.7%. So this is what we have for Alberta. I wanted to just quickly show you this data here as well. This is the hospitalizations. So one thing that John Snyder and I was talking before, and he was pointing out that this trend is actually, we saw that in various other reports as well in the past, that sometimes patients end up in the hospital and they're not even going to ICU and they die. They become so aggravated or it becomes such a bad situation that even before going to ICU, they die. So here, deaths sometimes and hospitalizations, they are tallying, and the number of ICU admissions are lesser. So that's also something to keep in mind. I will continue with this discussion. There is, number one, interesting data for comorbidities. Please tell me if you would like to hear that tomorrow and onwards. There is also interesting data from UK's newest technical brief. There is also interesting data in California brief. In all of those, I'm seeing a common theme, and that is vaccine efficacies after 20 plus weeks is reduced. If you give a booster after, so today the UK's technical brief, latest brief said after 15 plus weeks, it goes down to 20-30%. So almost becoming not valuable. So that is one, the vaccines and their efficacies. Secondly, it is not a zero death case for the younger ages, but still, younger age and no comorbidities are protective. Higher age and comorbidities are the uh, more at risk situations. Another thing that I see, and I think this is the most important aspect, and this is my last comment, and then we stop. That is, compared to Delta, Omicron's behavior generally in the population, for whoever somebody is milder. And I was speaking with a friend who works in a hospital in New York, and I was saying that what kind of patient um, percentages you're seeing. He said we are still seeing more unvaccinated. However, compared to how it used to be, it is their current percentages are less, severities are less. They usually end up going back from hospital. That is increasing, that they can go back. So there is a positive news. At the same time, we are looking like we're getting out of it. Please stay safe. Whatever makes you comfortable for being safe, do that. Just be safe. Few more months and we'll be out of it. Be safe. So, so Tiffany says, why are they so desperately trying so hard to jab our little children? I think that, again, Tiffany, I cannot really explain why are they doing what they're doing, but I would have thought that if they updated this table at the top, put the right data here, because if you look at this, 67.6% of COVID deaths were in unvaccinated in the last year. And then if you see here, so let's look at hospitalization, 68.1% hospitalization. Now in unvaccinated, their percentage is 29.96, still larger than, because the cohort is small. But this is not in congruence with this, although we saw at the bottom that the table showed still a majority in the unvaccinated. So my thinking is it would have been great to look at this data to say what comorbidities and what age brackets are more at risk, work with them more with priority, try to figure out how to protect them. There are people dying in larger numbers there. That doesn't mean leave the children alone or leave them unprotected. Ask the parents, tell them ways to protect their children. But you're correct. I think correct data, if it is present, that can guide people correctly as well. So, meanwhile, in America, says yes, please, vaccine and efficacy. So we'll do that. If you feel that I have walked through this data enough that you can now just go and dig through this and look at it, then I am totally fine to leave Alberta's data alone, and we can move towards the um, UK and California and the vaccine efficacies there. Okay, so thank you very much for being here. Thank you for being here with me during this time. Have a good day. Please like, subscribe, and share. Um, If you would like to support this work, there are links in the description. You can buy me a coffee, or you can use PayPal, or you can be a patron. Thank you. And tell me, would you like to do a chit chat, or should we meet tomorrow? I'll hang up and I can read your comments.